Manual therapy might be the reason you're struggling to walk, and I'm here to spill the secrets. Have you ever been to get some hands-on body work? It may be manual therapy or massage therapy. It could even be chiropractic work. And when you walk out, you feel like your legs are a little unsteady. You feel a little disoriented. Well, in my clinic, we call that baby giraffe legs. And it's very common to happen when we're changing how the body is functioning. You see, the body can get into a dysfunctional pattern that it begins to think is normal. And so then when we actually put it in the pattern it's supposed to be in, it feels like that pattern is abnormal. So it's important to understand that even though your body is telling you it's abnormal or I'm unsteady, that could actually be where you need to be. You just need to be aware that for 24 to 48 hours, you may feel like you have baby giraffe legs, and you need to be a little bit more cautious with your motion. Manual therapy can be very, very helpful in getting your proper alignment, helping improve your posture, and getting you back to walking, running, and doing all the activities that you love, which is great. However, when your body has been stuck in this dysfunctional pattern for a month or a year or even longer, it starts to feel like that pattern is normal, and it accepts that pattern as how it's supposed to be moving. So when you get some work done and things get released, the muscles get released, or the joints start moving better, or your pelvic alignment improves, or your posture gets better, everything can feel different when you're trying to move through the world. And that's why it's really important to understand what to do about it. You can also have muscle relaxation that causes some muscles to stop being so tight, but then that forces other muscles to actually kick in and start working, which is good. That's what we want, is everybody working normally. But when you initially get off the table, it may feel very strange and very different, which makes it important to understand exactly what's going on and exactly what you should be doing about it. So when I have patients who get off the table, and I can see as they're walking around that they feel like they have those baby giraffe legs, everything feels a little bit different, and I can actually see it on their face. Sometimes they brighten up because the pain has been relieved, and so they feel much better. But sometimes it's just this sense that things are different than they used to be, which is good, because if they're in my office, things were not good to start with. What I tell my patients when they get off the table and they feel a little unsteady on their feet, and I can see they're trying to figure out how to walk again, I give them a chance to walk around the clinic so that they feel that they're in a safe space and they're comfortable to kind of explore that motion. So we want to let you have an opportunity to walk for a minute or two just to kind of see how does all of that shake out with your body. But then I recommend for 24 to 48 hours until this motor pattern becomes adapted into your body that you avoid any high level activities. So it's different for everybody what a high level activity is, but definitely I would recommend avoiding things like running, jumping, and heavy lifting, because what will happen is that your body will do that activity because you're asking it to do it, but it will fall back into the old motor pattern that took you into that person's office in the first place. Now, I'm not saying you need to avoid activity forever or even avoid higher level activities forever, but you do want to avoid it for the initial 24 to 48 hours while your body is processing that information to make sure that you get the full benefit of that treatment. It takes a while when your body has been in a stuck position for a long period of time for it to be able to change and accept this new motor pattern. For my patients, I recommend that they putz around the house. So you want to keep moving because you want to integrate that movement pattern, but also avoiding those higher level activities. Again, just for 24 to 48 hours, because obviously we want this alignment to be able to work for you with those higher level activities. Just need to give your body a chance to adjust. Now, you may be saying to yourself, my professional who I'm working with has never told me this before. It may be because they're not realizing how much change is happening in your body. So this is something that you can use, or you can talk to your professional about. Is there anything that I should be avoiding for the next 24 to 48 hours? Every body is different. And so I don't have my hands on your body. I can't tell you what it is that you need to do in the first 24 to 48 hours. But if you see a manual therapist, and that can include a physical therapist, chiropractor, massage therapist, then I would recommend talking to them about any activities that you should avoid, even for a short period of time, because you want to get that full benefit of the treatment and allow your body to heal. All right, now it's over to you. Have you been to a manual therapist or chiropractor or massage therapist and gotten off the table and felt like, wow, things have really changed, but I feel a little unsteady because of it? It's a good feeling overall, but a little disorienting. So, do you have baby giraffe legs? Have you ever experienced that before? And what did you do to help solve your baby giraffe leg problem?